As you've seen, my name is Oluwaferanmi, but you can call me Precious, and I did my placement with Saskatchewan Health Authority as an intern. I worked in the Stewardship and Clinical Appropriateness Department, which is a team of clinicians, health workers, researchers, analysts, and administrators whose goal is to promote high quality patient care using evidence based practice. And this is done through quality improvement initiatives such as feedback and audit processes. I chose my special project because it is linked to one of the major tasks I had as an intern. I was working on patient charts in order to do a review of the opioid tapering practices at the Regina Chronic Pain Clinic. When I was reading up on opioid tapering so as to know what kind of data to collect for my chart review, I stumbled across the issue that many primary care providers have, which is that they find it hard to start and have a successful opioid tapering with their chronic non-cancer pain patients. As I started digging into the subject, I found that this issue could be solved with better communication between the care providers and their patients. So I decided to do some research into the communication barriers and recommendations related to opioid tapering between primary care providers and their chronic non-cancer pain patients. My plan was to then carry out both of the secondary and primary research, which was a literature review and interviews with care providers at the chronic pain clinic, respectively. I then made my findings into a presentation that could potentially be given to primary care providers so they can improve the quality of their care to their chronic non-cancer pain patients. And before I started this project, I had a timeline, and I can say that I finished all the things I had to do before the date that I predicted on my special project proposal. In fact, I presented my findings on the morning of March 23rd, and I believe that my project went really well. I was able to make and deliver a proper presentation, which I presented to the staff from the chronic pain clinic and the stewardship and clinical preparedness department. I got lots of comments and good questions at the end of my presentation. My presentation would also be included in the grant report for the Health Canada Substance Use and Addictions Program, which is the SUAP, and they're the ones who funded the chronic pain clinic for the past 3 years. And I believe that with a little tweaking and getting professionals to review it, my findings could be something that could be presented to primary care providers directly. And through my special project and just my fieldwork in general, I've been able to learn and enhance a lot of professional skills through this like enhanced research skills. I've had the ability to conduct interviews. I've been able to do better literature reviews. I can even conduct like a thematic analysis. I've been able to work with a multidisciplinary team. I've been able to improve my public speaking, and I was able to make a succinct and direct presentation. And something unexpected that I learned while doing this project is how chronic and acute pain differs from each other. For example, I had always just thought that pain was pain, and through this project, I have learned that chronic pain can affect many other aspects of a person's health, such as their mental health. I also learned that acute pain has a purpose, but chronic pain does not. Acute pain is there to warn an individual of dangers that, such as injuries, but chronic pain does not have a purpose. The most valuable thing that I've gained from this project and just my fieldwork in general is my love for quality improvements. Before my fieldwork, I had always just known that I wanted to do something in the health sector, but I wasn't sure what I could do with a health studies degree. But my placement has been able to open my eyes to the world of quality improvement as it relates to healthcare. And I plan to continue this part for as long as I can. Thanks for watching and listening.